Hi everyone, this is me again. Your girl has been really busy, so I've been on placement for the past 5 weeks. So this is my last week, and this week I'm going to be doing 4 days so as to make sure my hours are fully completed. So today is day two of my last week. So after today I've got another 2 days. So yeah, it's been quite hectic for me, because at some point when I started my placement, we're homeschooling the kids. So I started, was it first of March? That was when I started my placement. So as at that time, some of the kids were still at home, they were not back to school, and a few of them were going to school. Like my two youngest were going to school because they are in primary school, and my three oldest, they have alternative days they go to school. So at some point, some will be at home and some will go to school. So during that time, I'm still attending my placement. So here I am. I'm tired, and within this placement, I have written an exam. I have submitted an essay 1 of 2. Yes, I've submitted an essay, and the second one, like, I've had to put in an extension for that one because there's no way I'm gonna be at this placement and then be researching to write a 2,000-word essay. And in total, my placement hours for this period is 240 hours. So far in the past 5 weeks, I have not missed any day. Touch wood, touching my bonnet there, touching my wheel there. So I've not missed any day, and this week is going to be a very tiring one for me because it's a 4 days shift. So yeah, that's me. I'm super exhausted, and it's currently 6:49 just now. I left home exactly 6:30. So it took me 19 minutes, let's say 17 minutes to get here. So which is not bad. That is where I am for my placement. Is actually not quite far from home if I drove. So I'm currently sitting in the car park of my placement now. I know you guys were like, oh, what hospital? But you know what, that's kind of like confidentiality I need to keep. It's really not about me, it's about the I just saw one of my mentors from my previous placement. I'm in the car now. I'm just gonna wait till it's 7 o'clock before I find my way. So I'm just gonna wait till, I probably should be going now, because by the time I get into the dressing room, change, it's gonna be like 10:15 or 10 past, and I need to grab a cup of coffee as well. So yeah, I just thought I'll talk to you guys. This might come up and this video might not come up. You know, content creators, you tend to change your time every now and then. And again, I'm filming from my phone, sitting on my bonnet, hashed to settle perfectly with a book behind it. So yeah, just like I was saying, that I won't be able to share the hospital where I am for my placement, but it's been a very interesting ward, and I won't be mentioning any name of stars or anything like that, but it's a cardiology ward where patients who have suffered heart attack, or patients who are experiencing heart attack symptoms, they get seen, and some might be needing surgery, and some might just be needing like minimal intervention just to ease the symptoms of their heart attack. And some of these patients who have cardiac issues, they have comorbidity, which means that they have other underlying health conditions. So some who are actually living with the symptoms of heart attack, they could either be diabetic, they could be hypotensive, they could have like previous cancer, they could, like, you know, when we talk about comorbidities, that is, they have multiple underlying health conditions. and the and at times it kind of like get quite emotional for me at times when when patients, obviously, funniest thing is that when these patients come, they did not even realize they've had an heart attack. They just find themselves in the ambulance and then in the hospital, and then it kind of like get really emotional when if they were being diagnosed, like if the surgeons can like look through their results and stuff like that, and they ended up getting the result they were not expecting. I have had to deal with that about for about 2 weeks now, and it actually got really emotional for me as well. Like I found myself, after kind of like talking to the patient, to kind of like what, let them see reason that yes, you're in hospital, they found this thing. Can you just imagine if you were not close by, or if you did not have the facility to actually be in a hospital for them to diagnose what you were going through? That just think about the fact that yeah, you are in hospital, this symptom has been detected, and you're going to get treatment for it. And I understand that patients will be concerned, especially those who have been working all their lives. They've never had to take any time off work, so they'll be concerned about their finances. How are they going to pay their mortgage? How are they going to pay their car? How are they going to pay their bills? These are the things that patients, when they come into hospital, regardless of what they are coming into hospital for, these are what patients who come into hospital that bothers them. And I found myself saying to them, like, you know what, you're probably going to be in hospital for like 2-3 weeks, but think of the other part, that when you come out of hospital, you're going to have an additional 40 years added to you, because you're going to be in good health, and whatever you might have missed, maybe in terms of finances, I'm sure by the time you write a letter to maybe your mortgage provider or your bank or something, they'll be able to come up with something, because heart attack is not something that prepares you, like it happens. So, and I found myself that I haven't kind of like gone into like motivational speaker for that time, because I feel them, I know where they're coming from. So if after finding myself talking to them, it kind of like gets really emotional for me. Like I'll go into like an empty bed, into an empty room, and I will shed a tear, like I will cry, like that it's just so surreal that people are actually going through that, and they've at the same time concerned about their finances. So this is just kind of like a message to each and every one of us out there. Like, health is wealth. Take care of your health. It starts from what you put into your mouth, because I mean, guys, I'm not gonna go all physiology with you or anatomy with you, but go onto Google and type causes of heart failure. One of the things that will jump out at you will be lifestyle, diet, so that's why I'm going to emphasize on lifestyle and diet. Like, exercise if you have the ability, if you have the stamina. Walk, you don't necessarily have to go to a gym. Walk maybe half an hour a day. Eat healthy things, like stay away from food that will not treat your body right. And I always say this to people around me, that the heart is the engine of the body. If the heart stops working, people, nothing, like everything will shut down eventually. So in order to prevent that, watch what you put in your mouth. Watch what you put in your mouth. Watch what you eat, and believe me, your body will thank you for it. So it's kind of like so it's just hard. And I felt that health improvement as well, like health education, we should be talking about health education the more, because most patients that I've come across, they were like, the health education is poor, like people are not being educated more about their health. So I just thought I would do this short video. I might probably come up maybe over the weekend or sometimes next week. By then I will have finished my placement, but this is to just let you guys know that health education, health improvement is very, very important, and keep an eye on what you eat. So that'll be me. Thank you so much. If you have actually learned from this short video, please kindly hit the subscribe button, turn on your post notification, leave me a comment in the comment section, and don't forget to subscribe and share this video. And once again, my name is Wemimo, also known as that mom of 5, and I'll catch up with you in my next video. So I need to go now, the car park is filling up. See you guys later. Bye.